Is that knee still bothering you, Fred? Have you been able to do those mobility exercises that we've been talking about? As with so many of our body issues, much of the time, the pain is just a sign of an upstream or a downstream problem. So let's start at the ground and work our way up. One thing I notice is that a lot of us are losing our arches. And when our feet get flat, if you notice what's happening, then that rolls the entire leg inward, and then that can create a lot of medial stress on the knee. So that every time we squat or walk, we'll torque the knee in such a way that over thousands and millions of repetitions, it can cause a lot of pain and dysfunction. So, starting at the ground, if we can first make sure that our feet are more or less parallel. As we stand up, if you notice what happens when you squeeze your gluteus muscles, that rotates our legs to the outside, and you can see that the direction in which my kneecap pointing went from inward to outward, and that shifts the weight onto the outside blade of my foot and rebuilds the arch. So as you're standing throughout the day, try to get in 15 to 20 repetitions of rotating your legs at the hips, getting your weight on the outsides of your feet to build your arches and get a good squeeze here. Again, ears over shoulders, over hips, over ankles. The other thing that I see quite often is that in addition to losing the arch, we lose ankle flexibility. And when we try to squat with poor ankle flexibility, a very similar thing happens as I try to squat down. Because my knee can't go forward, it comes to the inside. Very similar mechanism. So if you refer to my ankle video, there are a bunch of exercises there that we can do to help increase ankle flexibility. Probably the easiest and most accessible exercises is reverse calf raises on a step or a block. So having just our feet on the edge of the block, holding on to something just a little bit for balance, trying to keep most of the weight in our feet, we'll go up on both feet and slowly lower on one foot, going all the way down, back up on two, slowly lower on one. If we can get in 10 to 15 repetitions on each ankle, this will greatly help our flexibility. Stretching tends to be not very productive, so that's why we want to focus on reverse exercises that increase our range of motion. Strong legs also contribute to improving knee pain. And so one of my favorite ways to improve leg strength is the split squat or lunge. I usually find it easier with my front leg a little bit elevated. And if we need a little bit more assistance, it's okay to hold on to something like a broom. Thank you, Fred, to help with balance. And so finding a small step or a block, something, a foot or so off the ground, we're going to have a strong back foot. My feet are mostly parallel. I'm not letting this foot come out to the side too much. Keeping a good upright posture, I'm going to go down and forward. And as much as possible, I'm trying to bring my hips close to my ankles. And of course, this isn't going to be possible for most of us, but that's the idea. And we just go down and forward until our body tells us that's enough, either due to balance, strength, or range of motion. And so all the way back up, nice and controlled on the way down, keeping a strong back leg, and then driving forward with this foot. Notice that it's staying in line with my foot. My foot, my knee, and my hip are all moving in the same direction. My knee is not collapsing inwards. If we can get 10 or 15 repetitions on each leg through a pain-free range of motion over a couple weeks, you'll notice a significant improvement in your knee pain. Patellofemoral syndrome, or jumper's knee, is a tendinopathy of the patellar ligament here. And so with most tendinopathies, we want to focus on eccentrics or weighted lowers rather than exercises that shorten the muscle and the tendon. An easy way to do this is with a sitting reverse knee extension. So you can do this with your foot or a shoe, or if you have already pretty strong legs and you're still dealing with the tendinopathy, a little bit of an ankle weight. So as we're sitting, we're going to use both legs to straighten out, take away the support, and then slowly lower the painful knee until we're down at the bottom. Straighten out with 2, hold it up for a second, and slow lower over a 3 to 5 second count. 10 to 15 repetitions of this every day will help a lot with that tendon pain on the front bottom of the knee.